I'm mainly here to talk about my experiences of the NIA and my experiences as a fellow and as a clinical entrepreneur. So I'll just dive straight in. Um, so for those that don't know me, I'm a doctor based over at Royal Derby. I'm also the associate CCIO for Derby and Burton, but I've been in and around the clinical entrepreneur space for several years, having gone through the NHS England Clinical Entrepreneur Program back in 2017. Um, and so most of my time is actually spent within an organization that builds what we call NHS ready software. And we built several different solutions with several different NHS providers. And one of those was with Somerset Foundation Trust, and it was around a maternity solution that actually controlled the response to an obstetric emergency. And it was this solution that got us onto the NHS Innovation Accelerator. So I just wanted to talk around how our vision for that solution has changed, how our ability to work within the NHS infrastructure has changed since being on the NIA, and then all of the other stuff that comes with an accelerator like the NIA. So I guess the key thing, and Jack's probably covered up a lot of this already, the key thing around being on the NIA is that you have to have traction and you have to have evidence and you have to have regulatory compliance as well. So those were the three things for us that were key, because we knew that we had a lot of that under our belt and we had enough traction to be able to get on the NIA. And that for us was one of the key things that we wanted to get out of the accelerator, was the acceleration of the solutions adoption within frontline medicine or frontline healthcare provision. And we were really struggling anyway, because I won't go into too much detail around the product itself, but effectively you've got an iPad next to the parent's bed, and you can trigger a postpartum hemorrhage from that tablet. And then at the nursing station, the roles associated with that emergency come up so that we can allocate roles from outside the room, which creates better situational awareness, faster response to theatre, and then improved auditability and reportability, which medically legally was phenomenal. The problem is getting the iPad stuck to the wall. The rest of it was easy, but actually going through a state to get access to pinning an iPad to a wall was taking months. So I said to Jack, look, Jack, I need to think about other ways to introduce this value into the NHS. And so the NIA opened up two doors. The first was grant funding. Obviously, Jack and Mindy are front and center of a lot of opportunities for support funding, things like that. So they actually helped us win an award. And I guess part of the help is just by being on the program and it being a recognized program for good innovation. So just being on that program enabled us to write a really compelling grant application. And we won some money from Innovate UK to build an extra module to the system, which allowed for automated follow-up after birth. So essentially, once a patient had gone through ERA systems, which is the name of the solution, you put in their patient details, and within 12 weeks, they receive a questionnaire to be able to assess their risk of PTSD, which is a very timely thing, given both birth trauma inquiry outlined that 1 in 20 births have a risk of trauma. And so that then lowered our barrier to entry massively, because we now had a pure software solution that was able to support these birthing parents, and then we'd retrospectively tell them about ERA systems, which is the longer term transformational innovation. So that has just turned the whole opportunity on its head to really support the end-to-end process of an obstetric birth. And if you have any questions, I won't have time to go into it, but if you have any questions about the solution in greater depth, I'm more than happy to meet with anyone and share details, or Kev and Tanya can share my details. So that was the first opportunity. And then the other thing that I really want to highlight around the NIA was the introductions that gets made, because Jack and Mindy have a fantastic network and again are in the middle of the innovation landscape, and made a really interesting introduction to Helen Falsden, who is the interim CNIO at NHS England. And having met her team, they said, well, could this software be used in other parts of the hospital? And I said, well, yeah, where are you thinking? And they said, well, A&E waiting rooms. And being an A&E doctor by background, I was kind of like, why did I never think about this? And that doesn't require estates because there's no drilling holes in walls. They're very much kiosk based, so freestanding. And now what we're piloting at Worcester, only a month after, no, 2 months after concept, we're now piloting the ability to support patients in waiting rooms by giving them the ability to trigger for mobility assistance. I feel sick, I'm in pain, I'm bleeding, and the triage nurse, because by the way, there's one nurse looking after up to 60 patients in a waiting room, which if CQC saw that as a ward would be shut down tomorrow. We are now looking at how we can support fit to sit patients and waiting room patients through this new innovation that was never designed for that purpose. So diversification was one of the biggest opportunities that came out of just socializing the network, spending time with Jack and the team. And that has now enabled us to support many more patients. And obviously, off the back of the Channel 4 Dispatches documentary, which I'm sure many of you will have either seen or heard about, we're now providing ERA waiting is the new solution to A&E waiting rooms free of charge for a small period of time because it's been sponsored, given the size of the problem that we're now seeing. So that's really what the network, the Accelerator, is about. It's about individuals like me talking about the opportunities, but also the challenges, and someone somewhere going, I think we can do something about that and save that. The other benefits of the network are, the other benefits of the Accelerator is the network. Phenomenal people, like-minded individuals who all come together to support one another, get into new areas, identify challenges. So, for example, if I was aware of there being a clinical pathway issue that I thought REM care could solve, I'd be able to highlight that and we'd be able to talk about that. And the other opportunity is the Health Innovation Networks, the ability for the NIA to push you into the new Health Innovation Networks. I can see Nick's on the call, and Nick and the team have been fantastic in our development. It's all about connecting us to all of the other HINs across the country to really spread awareness and adoption of that solution. So it's been just over a year since we've been on the program. Must have been up to a year and a half actually, but we've really benefited from engaging with other people, being pushed in all the right directions by Jack and the team, and then just by being able to immerse ourselves in the world of NHS, which even as an NHS clinician you think but it goes a lot deeper, and there are a lot more layers to uncover that quite frankly often a frontline healthcare professional cannot get into. So that was my 2 cents really.